So I'm Zach Smith, operations specialist with Partners for Andean Community Health, and every year we host an immersive internship program with Princeton's students that come down to Ecuador after a competitive application process. They come down to Ecuador for an 8-week period in which they work on a variety of different projects with us. And this year, as far as variety of projects go, it was no exception. We had Hilal working on several different projects, all the while volunteering and supporting staff at FIBUSPAM in a variety of capacities. So today, what we'll do is open up the floor to Hilal to present on her experience so far. She's in her 7th week right now, and in her 8th week next week will be spent with Project NIDO, doing healthcare, maternal and infant healthcare outreach with our group that is coming down to visit in Ecuador. So, Hilal, the floor is yours.
All right. Thank you so much, Zach, for introducing me. Like that said, my name is Hilal, and I've been a part of PACH's internship program this summer. So I've been in Riobamba for the last 7 weeks, and I'm going to do an overview of like everything basically that has been happening in my life for the past almost 2 months. So we can begin. All right. So first, a little bit about me and like who I am. So I was born in Sivas, Turkey, but after a short period of time, my family and we moved to Mongolia and then to Poland, where I lived for about 6 years. So I spent a majority of my childhood over there. And when I was in second grade, my family and we moved to the United States, and we've been in New Jersey ever since. And so with this kind of upbringing, I've had like a lot of diverse experiences, and I've met so many different people from different cultures and really had the opportunity to connect with them. And now I'm in college. So I'm currently a rising sophomore at Princeton. I'm majoring in chemistry with a minor, hopefully, in global health and health policy. And so from a young age, I've been very interested in healthcare and decided early on that I did want to become a doctor. So at the same time, I am really passionate about global health. So I think that was also kind of influenced by my upbringing with like being in all these different parts of the world. And this interest like towards global health has only been growing significantly over the years. So I'm really interested in hopefully pursuing like a career in medicine, but also with a strong focus on like global health initiatives and just like addressing health disparities worldwide. But yeah, so that's a little bit about me. So why did I choose to intern with PACH? So I think that in this position, the aspect that really stood out to me was the community based efforts that was emphasized in the application process. The huge focus on like improving community health and like especially within communities that don't have access to many resources really caught my attention. Like the most significant factor for my career aspiration is like community engagement, especially in these like underserved communities. And that was something that I saw like as a core element in the work that POSH does that I did not see with many other organizations. And so I love being within communities, engaging and communicating with people and like building these valuable relationships, because service has kind of been ingrained in me ever since my childhood. My parents are both educators who helped open schools and were teachers in like impoverished communities, which is why we like moved around a lot. So like Mongolia, Turkey, Poland. So growing up in a household that like prioritizes this value has been really integral to who I have become today. Something that my dad would actually repeat to my sisters constantly would be live for others. So working in a position that has these values and like would allow me to make an impact on a community in need was very valuable and important to me. And beyond that, I think PACH also places a big importance on innovation and like encouraging interns to take their own initiatives. So the opportunity for creativity and being like able to take charge of a project really stood out to me. And lastly, the opportunity to continue improving my Spanish. So, and just like immersing myself in a new culture was very exciting to me. I love to travel. I love to meet new people and just like learn about different cultures all over the world. So the cultural exchange aspect was also very valuable. And I think that that's just like one of the biggest forms of teaching beyond education, like school. Like traveling and meeting and learning about others teaches you so much. And I've definitely seen that in my past experiences. So I was very excited to have the opportunity to do that again in Ecuador. So yeah. So what did I learn with my internship? So just like an overall my experience, I think that I was able to gain several valuable skills and also like significant insights. I think one of the key learnings was like learning about the complexities of healthcare delivery in these underserved areas, specifically in Chimborazo and Riobamba, because that's where I've been. Just like learning about the challenges and solutions in providing healthcare in underserved and resource limited areas. It was really like interesting to see firsthand how like social determinants of health like poverty, education, or like access to clean water and sanitation just like significantly can impact a community's well-being and often like creates barriers in accessing healthcare and like contributes to these large health disparities. In this context, it was also very interesting for me to observe the interactions between doctors and public health workers. Sometimes there would be like differing opinions when I would consult with both between like a doctor versus a public health worker. But that really gave me the insight of like how balancing these perspectives requires making decisions that are not always straightforward, but necessary given like the resource constraints and like the unique challenges that these communities face in developing countries like Ecuador. And then in terms of skills, I think that I was able to really improve my project management abilities by working on various health projects, which I'll detail in a little bit. And just like making sure they were complete on time and like met their objectives. And with that, I also coordinated and like talked with various people, including my supervisor, Zach, other members of like PACH and like doctors and health professionals at FIBUSPAM. Um, and I think also in terms of organization skills, I had the opportunity to learn about like using new software that I think I will definitely continue using in the future. And beyond that, I would say just improving like my problem solving skills. I think I really learned to address challenges and also adapt plans, like developing like these solutions that really like necessitates the use of like critical thinking skills because I was working in the specific context of healthcare in Chimborazo. So like learning how to analyze problems through the lens of the local environment here was something that was very important. I think this also kind of goes into like cultural competence, but like basically just like really tailoring and like learning to understand the change challenges faced by these communities we're serving and like developing solutions that are tailored to their specific needs. So I think that was just like a very big major learning experience for me overall. And then lastly, just communication and specifically cross-cultural communication was another critical skill. I think I was like to really develop my ability to communicate with individuals from many different backgrounds, especially at the hospital. There's doctors from so many different countries. So just like learning to navigate that language and then like cultural differences and just at the same time really like improving my Spanish language skills. I was taking classes at the same time, but also just like engaging daily with people at FIBUSPAM required me to utilize Spanish. So that was definitely a big aspect. But yeah, okay. So these are just some pictures. So I think beyond professional development, one of the most enriching aspects of my internship was just like immersing myself in the culture of Ecuador. Since I was the only intern with PACH this year, at first coming here alone was a bit difficult, I won't lie. I didn't have like a built-in friend group that would come down from Princeton with me. But I think at the same time, this was kind of like a blessing in disguise because I made the effort to meet a lot of people and made a lot of amazing friends. They were all very welcoming and so like excited to show their country and their culture to me. And I think this was just a very great opportunity for me to like really immerse myself into culture here because I was learning from like local people who lived here. Um, and also just very big aspect of improving my Spanish because I had no option but to speak Spanish with almost everyone. Um, but I think I just really made a lot of wonderful friendships that I'll cherish forever. And I don't think that they'll end when I leave Ecuador. I'm already getting invites to come back to Ecuador. And I've also been inviting them all to come to America or Turkey if they can, so that I can also show them around. But yeah, like I really love to travel, meet new people, see new cultures. So during this time, I try to take advantage of like any opportunity to travel and immerse myself in activities in Ecuador. I had the opportunity to see Chimborazo and Cotopaxi, which was so beautiful, and I really love nature. And it's not really something that I come across very often in America since I live in North Jersey and very close to New York City. So those trips were just like very amazing for me. I think another highlight was just the culinary adventure. I tried a variety of traditional Ecuadorian foods and a lot of different fruits, which was probably my favorite part. And I think just in general, like just sharing meals and these like visiting these markets with my friends was not only about the food, but also like just the conversations and the memories that I made with them. And like I said, visiting markets was another activity I love doing. This is also not something that I come across very often in America, but it is also a very big part of like Turkish culture. So being a part of such like vibrant places and peoples and vendors and shoppers, like just all just chatting and like calling your name to buy something was just like something very amazing for me. And I just really got to explore, learn about like local goods and ingredients, and like understand kind of like the daily life of the people who live here. I watched numerous local events like desfiles, like experiencing their music, their traditional dances. I saw a lot of traditional clothing that I had never seen before. And so I think this really allowed me to experience their heritage and like the community spirit that is really exists amongst the people that live here. And I think that beyond just having a lot of fun with all these experiences, it also like really strengthened my belief in the importance of respecting and valuing like local culture. I think it's also very crucial, like Marty said, like to get to know people all over the world and see different cultures, to really have like a broad worldview and like an open mindset. And I think it also just taught me again the importance of approaching my work with like cultural sensitivity and having like a deeper appreciation for the communities that we're serving, which is, I think, very important, especially in the world of healthcare. So these are just some pictures. And there's a couple more in the next slides of just like everything I've been up to at Ecuador, but everything was just very amazing. But next is collaborating with Hospital FIBUSPAM. So my work was mainly with PACH, but at the same time, PACH works closely with the hospital. So during my internship, I also had the opportunity to work closely with the staff at FIBUSPAM. And it was amazing for me both professionally and personally. And these are just some pictures from the hospital. But I really want to build close relationships and get to know the staff, their jobs, and their experiences. From day one, I really tried to like actively engage with the doctors, the nurses, and other health professionals. And my interactions with them was not only about like engaging, like exchanging knowledge, but also like understanding the human side of healthcare and like the challenges and the experiences that they face daily while like seeing patients. And another very rewarding aspect for me was the opportunity to just be in a hospital environment constantly. I had the opportunity to shadow many specialties, including like gynecology, family medicine, ophthalmology, general surgery, pediatrics, radiology. So I really enjoyed having like a perspective of many different areas of health and just like the experience of interacting with patients. I got to see how doctors communicate and care for their patients. And just like, I think this also really allowed me to understand a lot of the barriers to healthcare access within the community here, because I saw directly like what the patients were telling the doctor, what like concerns they were bringing up. So I think that was very valuable for me. And a big part of like my project focused on consulting with doctors and health professionals like continuously. So I think that was very crucial to develop like relevant and effective planning and like healthcare interventions because they're the ones that interact with the patients and the communities that we're serving firsthand on a day-to-day basis. So just talking with them, getting their advice, and just like learning from them overall, I think really allowed me to understand healthcare in Ecuador and just like the patients and the communities that we want to target with the project. And beyond this, I really saw the importance, I think, of teamwork and communication and providing like high quality patient care. There were various instances when like I witnessed where a patient would come in an emergency and like the doctors and nurses would know like what to do on the spot, like how to talk, how to like collaborate, how to communicate to get like the what that patient needs very quickly. So that was very also cool to see. But beyond just professional experience, I think building close relationships with the staff was really a highlight of my experience. I talked to them about their daily life. I talked to them about like their journey to medicine or just like how they came to Ecuador. We laughed at jokes together. We celebrated birthdays together. So just being around such a welcoming and like passionate group of people was very incredible. Just like very inspiring for me. And I think these connections not only helped me with professional development, but also just like in a personal and like a very personal level, it was also very enriching as well. So just very grateful that I had that experience. Now we can get into what I did with PACH and like the projects that I worked on. So there were three projects in overall, and the first project focused on cervical cancer. Um, and so just like cervical cancer screening, treatment, and prevention project planning. And the main purpose of this project was to establish the planning for like an extensive cervical cancer prevention program that focused on the indigenous and rural communities in the Chimborazo province. Um, so number one, why was this project important to take on? Cervical cancer is a highly preventable disease, yet unfortunately, it remains a significant global health issue. It's like the fourth most commonly diagnosed cancer and cause of death in females worldwide, and especially a very significant healthcare challenge in Latin America and Ecuador, where, as you can see in these graphs, there is like higher incidence and mortality rates in women in comparison to like in North America or like Western Europe. And in Ecuador, there have been some national efforts to like combat this issue, like with HPV vaccination programs that was established in 2019, but it hasn't been very successful. Similarly, something that was also like very interesting that I saw was that although screening services are offered in some healthcare facilities, women are not like actively invited for screening. So only a fraction of women are screened regularly, and vaccination coverage has declined a lot over the years. And so unfortunately, cervical cancer remains as like the second most commonly diagnosed cancer and cause of cancer death in women in Ecuador. And some barriers to like why these like programs are not working included like insufficient like public awareness and knowledge, safety concerns, and like difficulties in access and cultural barriers. And these barriers only become pronounced in females who live in rural areas and belong to indigenous communities in Ecuador. And Chimborazo, it has this like the largest population of rural indigenous people. And that's the population we're directly trying to serve. However, like the barriers to care in Chimborazo specifically have not been entirely focused on in the past. So our goal was to kind of combat this issue and like improve healthcare access and delivery by assessing previous initiatives and collaborating with like healthcare professionals and experts. And so the primary purpose of this project was to create like a framework for implementing cervical cancer screening, treatment, and prevention. And by assessing previous programs at FIBUSPAM and consulting with health professionals and experts also at PACH, I aim to identify and address like barriers to increase access to cervical cancer information and also healthcare services. And another key aspect of the project was the development of like an educational deliverable, which included the transcript and planning of a video that provides like an in-depth overview of cervical cancer and like prevention methods like HPV vaccination and screening and treatment options. But I'll get more into detail about like what that video includes in a little bit. But information sources. So for this project, I use data from sources like the Global Cancer Observatory and like the HPV Information Center, and also conducted interviews with like healthcare professionals from Hospital FIBUSPAM and experts from PACH. And I think these interviews provided me with a lot of valuable insight into the challenges and the barriers to cervical cancer care that are specifically faced here in Chimborazo. And this project relies on the involvement of like various stakeholders, which that includes like community health leaders and like health workers. So I worked on conducting like a stakeholder analysis to like identify their roles, their interests, and like levels of influence so that we can have like an effective collaboration throughout the implementation of this project. So geographic and community outreach strategy. Another important aspect of this project was doing like a geographic analysis and taking into consideration the challenges of reaching rural communities in Chimborazo, whether that's due to like mountainous terrain or like the climate. So I made plans for like effective logistical planning. For example, that included like ensuring portable and like lightweight equipment that would be utilized in these medical campaigns. Additionally, like I planned out a community outreach strategy of like how we can actually spread awareness and the word about such campaigns. And main stuff that I identified were like utilizing the radio, social media, and local television. But I think it was also important to emphasize the use of both Spanish and Quechua so that we can reach a wider audience and make sure to address like the cultural and like linguistic barriers that people usually face in these communities. And then project implementation phases. So this project, I plan it to be implemented in 3 phases, which is something different to kind of like what has been done before at FIBUSPAM. So the 3 phases would include community education engagement, screening and treatment, and then follow-up. And so the first phase would focus on like raising awareness and addressing the misconceptions about cervical cancer through like a structured educational session and just like interacting with the patient. And while talking with doctors at FIBUSPAM and like people at PACH, one aspect that they emphasized continuously was just like the lack of knowledge and awareness of um in these like people in these communities. And that's just like a very significant barrier to the acceptance of screening and treatment. So by like prioritizing education and engagement, I tried like with this project to like build trust and like ensure community members understand the importance of cervical cancer prevention and care. And so with this, it would also include like heavily utilizing the educational video. And the second phase would be like the actual screening and treatment. So like actually going out to these communities and providing free screening and treatment services. Um, Doctors also like emphasize logistical challenges and like cultural barriers that like often prevent women from accessing these services. So having and planning these mobile campaigns, we would bring healthcare directly to the communities, ensuring that these services are accessible and that those who are providing these services are also like culturally aware and sensitive. And we planned that like there would be various health services involved, including like VIA tests and like pap smear tests, and then diagnostic exams like colposcopy, biopsy, and then thermocoagulation for on-the-spot treatment. So that's all part of the plan. And then the third and last phase would be follow-up. So 2 to 3 weeks after the initial screening and treatment, follow-up visits would be conducted to provide like additional care and like to ensure that patients receive the results and necessary post-treatment support. Past campaigns often like lack this aspect of follow-up due to resource or like time constraints. And this was a very, very big, important aspect. I think by including this phase, I wanted to ensure like this continuity of care and like addressing ongoing health concerns, because after you screen and treat, oftentimes in past campaigns we would never see those patients again, but you don't really know what happened after you treated, or like letting them know about their pap smear results or their biopsy results. So having this phase would also reinforce just like the importance of ongoing prevention for the patients that we would be serving. So this 3 phase plan, hopefully, I think would make this project more effective. And the video transcript and target audience. So that's the main educational material that I created. So I plan and design the entire transcript for the target for the video with like various target audience within the community. And those target audiences included like women of screening age, their families, and also young girls that would be eligible for HPV vaccination. And the content was like tailored to address like specific concerns and misconceptions that were identified by the doctors at FIBUSPAM. So I'll do a quick rundown of like what the video would include. So number one would be like introduction and like understanding cervical cancer, like what it is, how it is caused by HPV. Then it would include like statistics and importance of screening and like highlighting the high incidence and mortality rate of cervical cancer in Ecuador, but then also emphasizing the importance of early detection and that this is also a very highly like preventable disease. Then it would go into screening methods, so like VIA and pap smear tests, and not only explaining what these tests are, but also it would go through what a patient should expect within the procedure. So like actual step by step, like what they would go through if they actually went through with the screening. And then the next portion would be addressing like frequently asked questions and misconceptions. So that could be about like screening process, like pain or like side effects, and that kind of questions that was brought up by the doctors. Then it would include like post-screening and treatment options. So again, like outlining the next steps after screening, which could include the use of thermocoagulation for like treating precancerous lesions, or like further diagnostic exams if that's what's necessary. So that's like colposcopy or like biopsy. And so again, like going through step by step what they would expect in each of these procedures. And then the next part would be HPV vaccination. So I think it's also important to talk about other prevention methods, especially for young girls. And so just addressing common questions about safety and like the efficacy of the vaccine. And last, and I think this is probably one of the most important parts, would be testimonials. The video would also include testimonials not only from women who have undergone screening and treating, but also from male community health leaders and spouses, encouraging others to participate. Because a significant barrier that was identified is that many women here ask for their spouse's permission before seeking medical care. And so the material that is also planned should not only target women who need treatment, but also the men, because as much as it is important to inform the people who are getting the treatment, if they're not the ones making the decisions, it won't have as much of an impact. So informing both men and women for the acceptance and like success of these health services was like a very important aspect that I took into consideration. And then after the video, we have like financial projections and tech considerations. So I also did like an inventory of the material available and like discuss with professionals on like what's actually needed to implement this project and like calculate the financial projections, which include like detailed costs and like expenses for each phase and like investments that we would make for like reusable equipment. I also talked with like doctors on any new equipment that we could implement to make these programs more successful. For example, one recommendation was a new tool called Evaculpa, which is like a portable and handheld colposcope that can like be easily utilized to do diagnostic tests in rural communities. Because one barrier that was actually also identified is that some women in the communities do not really prefer the VIA method for screening, and they expect doctors to use a colposcope as part of the screening. However, as you guys probably know, like traditional colposcopes are very impractical for field use due to their weight and their size. It gets very easy for them to break in like rural communities. And so utilizing this new equipment will not only maintain that practicality in the field, but also address this concern of some women and then hopefully address those barriers to accessing care. And lastly, I conducted like a thorough risk assessment to identify potential challenges and like develop strategies to overcome those risks, whether that's like logistical planning, community engagement, financial planning, and then also consider aspects like cultural norms and barriers, financial constraints, potential resistance even from like healthcare providers. And to ensure the project sustainability, I focused on like planning the training of local staff or like creating a self-sustaining financial model. And I think overall this project has significant potential for replication in other regions in the future. So I also tried to provide recommendations on how this can be done successfully. But yeah, so positive impact and just like what's next steps. So I think hopefully this project could have a long-lasting impact on the local communities by reducing cervical cancer incidence and mortality rates through increased awareness, screening, and treatment. And so just like by addressing these specific barriers, I aim to create like sustainable and replicable model. And I think that for the next intern that comes after me or anyone else who decides to take on this project, their next steps would include first creating the educational video, because I created the transcript and like gave suggestions on like what subtitles to use or like what visuals to use. So someone actually taking that on and like creating that video would be, I think, amazing. And then securing funding and resources, and then continue to refine and actually implement the project plan. And I think it would also be extremely useful to develop like a system for monitoring and evaluating the project's impact, whether that's like data collection on screening rates, treatment outcomes, and just like also community feedback to continuously keep improving the program. And I think for long-term goals, I think expand the program to reach more communities in need would be very impactful, because there are so many communities in need in Ecuador, not only in Quito, not only in Riobamba, not so there's a lot of different cities that I think we could reach. And I think part of this would also be working on collaborating with other healthcare professionals, community leaders, and also just like organizations and stakeholders. I think that just would be very crucial to the project's like long-term implementation and just success. So that is overall what I did with the cervical cancer project. Um, one second. The second program was the nutrition project. And that was basically, I worked on like an implementation and sustainability planner. And this project aimed at addressing, unfortunately, there's, as you guys maybe may know, there is the big issue of like stunting and obesity. So the dual issue of malnutrition in Chimborazo. And previous interns before me conducted like a lot of research on malnutrition in Chimborazo, but they also emphasized the need for intervention. So building on their work, my job was kind of to develop and design a comprehensive program that can be implemented to combat this issue. So the purpose of this program was to provide comprehensive nutritional support and education to parents and children in Chimborazo. And the project was divided into 6 phases. And through these 6 phases, I kind of learned about the different steps that you need to take for project management and project planning, which is something that I hadn't really done before. So I learned a lot with that. And phase one was design. And with that, the first step was creating a purpose statement. And this is something that Zach actually kind of instilled in me with everything. Whatever you do, purpose statement. So I'll read you guys the purpose statement that I came up with. So the purpose of our nutrition program is to be a source of comprehensive nutritional support and education for parents and children in the Chimborazo province by creating initiatives that address the dual issue of stunting and obesity, promoting equitable gender dynamics in child rearing, and implementing localized feeding guidelines. We will empower communities with the knowledge and resources needed to foster sustainable health and well-being. So that's like the overarching goal of the project. And so after that, I worked on like defining core values and like developing target audience specific messaging and like brainstorming names and slogans for the project. Phase two was get discovered. So that was working on like how we could create the online presence of this program. And so that could be like utilizing Facebook, like social media, Instagram, WhatsApp, the radio, TV channel features, and just like creating a website even. And I developed like a social media strategy and included like content themes and like even posting schedules of like how this can work out. Phase three was relationship building. So I worked on identifying the different target audiences, which included not only parents and community leaders, but also educational institutions, donors, volunteers, and also international organizations, whether that's like UNICEF or WHO. And also mapped out the customer donor journey for each of these target audiences. This is also something that I had never done before. So I learned about the different stages of like awareness and consideration, decision, retention, and advocacy, and how each audience would interact with these different stages and what can be done to like overcome the specific challenges or barriers they might face in each part of this project, and just create like an engagement plan with specific activities to encourage like interaction from these audiences. Phase four was sustainability and commerce. So I worked on identifying potential revenue streams, whether that's like grants, donations, events, and fundraisers, and did kind of like a feasibility and impact study of like each revenue stream to see what was most profitable, but also impactful for the communities. And then develop like an engagement plan with like local organizations, businesses, and international organizations of how we can work with others to implement this project. Phase five was community growth. So that was brainstorming marketing assets to engage each audience. That could be like including social media posts or like monthly newsletters, flyers, etc. So there's a lot of different ways. And I developed like a content strategy and like feedback mechanism also to ensure we're getting engagement with what we're putting out. And phase six was implementation plan, which is, I think, probably the most detailed area. So I worked on setting like a project timeline with like key milestones and like detailed tasks, and like manage resources, address potential risks, and like develop communication strategies on how like all stakeholders of the project would be kept informed and engaged in the implementation of this project. And the implementation phase also include the planning and designing of a specific workshop that can actually be implemented in the future, and also to hand out deliverables. So first I'll talk about the workshop that I thought of. And the workshop focuses on the importance of nutritious breakfast and meal planning. And the reason that I wanted to create like a workshop on breakfast was that previous interns emphasized that food given at school, which is usually only milk and cookies, is the only source of food that a child receives during the day, as parents are too busy with other responsibilities to prepare breakfast, and even later, maybe not available to make lunch. So I thought it would be very impactful to have a workshop that focused on like importance of breakfast, food groups, how to have a balanced breakfast, and like utilizing local nutritious foods and learn how to meal prep and plan, and also have like a cooking workshop where we would provide them with like two nutritious recipes and they would go through creating that meal with the chef and like taste testing all together. So just creating this very engaging session. And then I worked on creating two handouts. So the first one on the screen right now is focused on educating community members on the components of a balanced diet. And the biggest focus of this was like tailoring this to the specific resources of Chimborazo and like really showing to them how they can incorporate local foods and nutrition that are most accessible and feasible for them to find, and can make maintaining a balanced diet easier and more accessible for them. And so that's the front. And then next page is the back. So basically, this kind of how they can utilize the resources in Chimborazo to have a healthy diet. And the second deliverable on the next page. So is a brochure that focuses on creating a guideline for healthy eating tips and more specifically just like complementary feeding guidelines for mothers of Chimborazo. Previous interns had said that there's a lot of information out there by WHO on like complementary feeding guidelines, but having something that's really specific and tailored to Chimborazo would be extremely helpful. So through this brochure, the main goals were to like provide tips for complementary feeding, but tailored for mothers in Chimborazo in a format that's easy to understand, but still based on WHO guidelines, promoting like healthier food choices and eating tips to improve children's growth and development, or educating mothers on the importance of like meeting minimum meal frequency and like dietary diversity, and just like encouraging again the awareness and the use of like local traditional foods and products and like complementary feeding. But yeah, so I think overall, hopefully this project will make a significant and positive impact on the local community. I believe again, the biggest part of like improving health and well-being is education. So by providing these educational resources and like engaging programs and workshops that promote their local culture and food, I think hopefully we can empower parents and community members with like the knowledge and skills that they need to like improve their family's health and well-being and hopefully fight this issue of like malnutrition in Ecuador. And so like what's next for PACH? I think first would be just creating and more educational material and refining what I have done. I think it's important to continuously improve what we have created based on especially feedback from the participants. And also, I think another aspect would be translating the material into Quechua would definitely help with like having a higher outreach and like more reaching more communities who might not speak Spanish, even in Ecuador. Second would be securing funding and resources. So just like applying for grants, donations, and partnerships to secure the resources that we need to actually implement this project. And third would be strengthening community relationships. So building and maintaining strong relationships within the community leaders, health workers, local organizations, and like initiating collaboration with organizations. For example, I actually had the opportunity to talk with the director of like the International Potato Center, where they focus in Ecuador, where they focus on improving food and like nutritional security by introducing like healthier diets for these vulnerable populations in Ecuador. So within my project plan, I also recommended like these organizations that we could potentially collaborate with. So having someone actually initiate these relationships and like start these collaborations would be really, really important, I think, for just like setting off this project. And then fourth would be like implementation. So I think just starting this program would be amazing. And we also have a nutritionist at FIBUSPAM. So I think she would have a lot of contribution and leadership in this project. And fifth, this is more like a long-term goal after it's successfully implemented in Chimborazo. Again, similar to the cervical cancer program, I think scaling it up and replicating this project in different regions with similar needs would be very, very incredible. But yeah, that was my second project. And the last project, I did an educational institution health study. And so, okay, the study is titled Addressing the Gaps in Educational and Institutional Health Outreach in Rural Communities Around Riobamba, Ecuador. So this aimed to identify the gaps in educational and institutional health outreach in rural communities. Rural areas in Ecuador, particularly in Chimborazo, face a lot of significant like health challenges, whether that's accessing health education or accessing health services. And so our study focused on kind of assessing the current situation of these rural communities. Previous studies have emphasized the effectiveness of like survey-based and like participatory research, like to really understand these health disparities. However, while doing my own research of like what is already out there, something that I found out that was very interesting is that, especially in Latin America and Ecuador, there is a significant gap in information and data concerning health education and availability of health services in rural schools and communities. It was even more surprising because I found a lot of health intervention programs that are directed towards Ecuador. And this is actually quite alarming because with that extensive data, it's difficult to really like actually assess the health situations in such communities. And oftentimes organizations who are implementing these interventions might work on just like assumptions. And although it might be well intentioned, this might cause these interventions to be not entirely sufficient or even not be socially or culturally acceptable. So our study really aimed to fill this gap by conducting these surveys. So we conducted a quantitative survey, and it was conducted in rural schools, targeting school administrators and teachers. And we used a survey with 15 questions. The survey was administered in person over 2 days, and we visited over 15 schools, surveying over 100 participants. And to collect this data, we used the Likert scale method, where it involved asking participants to kind of like rate their level of agreement with each statement on a scale from 1 to 5, where one meant like completely disagree and 5 meant completely agree. And then to analyze this data, we use descriptive statistics, calculating like the mean score for each question and like determining the overall level of agreement or satisfaction with each statement. So I want to go through some of the key findings that we had. So again, we had 3 different sections in our survey. One was school environment, the second one was community health, and the third was women's health services. So for the key findings in school environment, the most agreed upon statement was that school absenteeism is a significant problem. That had an average score of 3.34. And the second one was that the nearest doctor to school is easily accessible, which had an average score of 3.31. So these are the most agreed upon statements. So we found out there is a general perception that access to nearby doctors is adequate. But while the score is like relatively high, there could still be opportunities to improve accessibility further, whether that's like reducing wait times or like increasing the number of like available healthcare providers. And the least agreed upon statements were students have access to vision care services when needed, which had an average score of 2.35, and that there are adequate oral health programs available to the students, 2.84. So those are two aspects that were pointed out that they were really lacking. Key findings for the community health portion. The most agreed upon statements were that there are adequate health services available in my community, which had an average score of 2.85. So although the score is not very high, it suggested to us that while some community members find these services adequate, there is still considerable room for improvement. And the second statement that was most agreed upon is that health education programs are accessible and effective in my community, which had an average score of 2.8. So although these communities find these programs somewhat beneficial, I think there's still definitely room for improvement for both because these scores are definitely not that high on a scale of 1 to 5. And the least agreed upon statements were vision care services are accessible for community members, and that oral health services are readily available for community members. So there's definitely this trend in both the school environment and the community health that we can see with like these least agreed upon statements. And lastly, the key findings in women's health services. So the most agreed upon statements were family planning services are readily available to women in my community, and that maternal health care services are accessible and effective. But again, these had an average score of 3.06 and 2.96. So although there's a moderate satisfaction with these 2 points, there's definitely still a need for like ongoing support and increasing the availability of these services. And the least agreed upon statements were: Number one, there are sufficient services available for childbirth in my community, which had a score of like 2.46, which is extremely low, and that there are adequate health services available for infants in my community, which had a score of 2.78. So overall, our findings kind of indicated that there is a moderate satisfaction with some aspects of health services and educational programs, but there are like significant and alarming gaps in other areas such as vision and oral health services and maternal and infant health care. And so by identifying these gaps, we can develop like targeted interventions to address these specific needs. And on the next slide, there are some pictures of the actual surveying process. So we went out to about like 15 schools and surveyed over 100 people. So it was very engaging and like very good experience for me. I just love being a part of the community and like doing this community engagement part of this work. So I really enjoyed this part of the experience. And so what's next for PACH? I think for this project, the next step for PACH with this information would be to first conduct like an in-depth qualitative study, just because our survey was kind of more general, hitting these three different areas of health. So understanding what might be the reasons for this, like dissatisfaction with the specific health services, and like really trying to understand what, for example, might be the barriers to accessing vision and oral health services and like maternal and infant health care. And after doing this, I think it would be basically time to develop more effective and targeted health intervention programs that are addressing the specific needs of the community that are like identified by them. So hopefully, I think that would have a very positive impact on the communities here. And so those are my three projects. So what's next for me? So my internship isn't over just yet. Like Zach said, next week I'll be joining the Caravana trip in north of Quito. And beyond helping with like the programming and events in these medical missions, I also want to continue building on my current projects. And specifically, I have two main ideas, which is about the cervical cancer project and the nutrition program. So for the cervical cancer project, like I said to you guys, I've had the opportunity to talk with various experienced doctors and experts and like their experiences with patients. But I think discussing with patients themselves and like observing the barriers to care is just as important, maybe if not more. So next week, I want to really try to engage possibly directly with the patients to gather their insights, experiences, or even just observe. I think this would allow for us to have an even more comprehensive understanding of like what these barriers are and would be very valuable to the report. And in addition, with the two deliverables on the nutrition project, we'll be test running them. So we'll see how the community responds to them, assess their effectiveness, and like learn what can be improved. Because I think getting feedback from the people who we are trying to serve is the most important aspect in these kind of interventions. And yeah, I think overall, this internship not only allowed me to contribute to like meaningful projects, but also has been an incredible like experience for my personal and professional growth. It's really solidified my passion for global health and my commitment to working in like underserved communities. And before this internship, actually, my first year of college, I was somewhat hesitant about pursuing a career in medicine. I was like, oh, is it too long? Like 8+ years. But I think this experience really reinforced that this is kind of like really what I want to do. I realized that everything in life is difficult. So doing something that you are passionate about and like something that for me has an impact on these communities where I can serve people was very important. So it really reinforced that for me. And so yeah, it has just been like very valuable in shaping my future goals. And so I'm really excited next week to continue working with PACH and just like engaging with the community because that's like my favorite aspect and just further developing the projects. But yeah, I'm just very grateful that I've had this opportunity and want to especially thank Zach for being a part of the whole process and just being a wonderful supervisor. He's helped design this whole program for me. So thank you very much. And just to everyone else at PACH and FIBUSPAM who made this experience very, very special